Hi, everyone. David Feinberg here. Really, really excited to spend some time with Dr. Barbara Van Dalen to talk about mental health, to talk about mental health and COVID, to talk about what we can do to help our veterans. Barbara's had, I think, a pretty impactful one woman force on really improving the lives of folks with mental illness, depression, anxiety, a host of things, post traumatic stress disorder. So, Barbara, why don't we start by you introducing yourself, and then we can kind of just get into a casual conversation.
Sure. Well, thank you, David. It's really a delight to meet you and to have this opportunity. So I'm Barbara Van Dalen. I'm a clinical psychologist, and I am the executive director for the Prevents Task Force office. And Prevents stands for the President's Roadmap to Empower Veterans and End a National Tragedy of Suicide. That's the Prevents, and it took me a while to be able to do that without having to think about it. That's what Prevent stands for. I know we'll talk about that and sort of what came before and after, but that is the office that I now hold.
It breaks my heart as somebody trained in psychiatry who spent a lot of my time at the VA in my training. You get to know veterans, you get to know the VA system, which I'm a big fan of. But the suffering and the access and the aloneness and the shame are such big, powerful things that I think drive veterans to feel like they don't have a place to reach out. So this program, can you tell me more about it? How what it's supposed to do, how you're measuring, and actually how we can help?
Sure. When I got a call, literally May last year, asking whether I would step into this role to be the executive director, and I was incredibly honored. And also, trying to get sort of my bearings. And I read the executive order. I was very impressed with the vision. And my first thought was, and my first request was, if we're going to do this, if we're going to try to end veteran suicide, the only way we can do that is to tackle suicide more broadly in our nation. And so this effort is intentionally aspirational. It is intentionally focused on public health, and we can talk a little bit about what that means in particular, but I think folks will understand once we talk about, a few examples of what that means. There is a focus on research, gathering information, but not for research's sake. It's really about how do we break down silos so that we learn what is working for what kind of individual. We focus on a lot of high-risk groups, not only our veterans, but other communities that are at high risk for suicide. And there's a lot of focus on developing, sharing, implementing programs at the community level, because that's where the magic happens. Last thing I'll say is that's what was happening until, 2 months ago. And then when COVID hit, we've continued to focus on that, but we've also pivoted to really focus on very serious concerns that many of us have around the impact of the COVID crisis on mental health in general.
So talk about the public health piece that you mentioned,
Sure.
and I think you could talk about that pre-COVID and now COVID, right? Because it fits for both.
Absolutely. Absolutely. So a public health approach really is an approach that focuses on everyone. So we want to reach everyone with basic information. So if we think about, what we've done in some of our other public health, public safety kinds of efforts, like friends don't let friends drive drunk. Everybody has learned, before COVID, to cough into their sleeve, into their elbow. That message was for everyone. So public health has a basic message for everyone. And then there are certain individuals in our society who are at higher risk because they have risk factors. And so there's a more targeted approach to that group of individuals. I'll use myself as an example. I know that I'm at risk for heart disease. My father died of heart disease. Both of my brothers have had heart attacks. So because I know I have gotten the information about what to do because I'm at high risk, that's sort of one of those targeted efforts of information that goes to people like me around heart disease. And then public health also, we think about it like a triangle. At the top is everybody, in the middle are people who are at high risk, and at the very tip are the people who are at very, very, very high need. People who have severe mental illness, people who have other very high risk factors, people who have attempted suicide before. So we then go after those folks to reach them, outreach, wrap around them. That's public health. So it's about early prevention, early identification, early intervention, targeted for folks in need, and very, very intensely and intentionally targeted to people who we know are at the highest risk category.
Can we talk about access for those folks in the VA system? And I love your perspective because you talk a lot about beyond the VA, but even access for mental health in general. Can you talk about access and how you think about it?
Yeah, no, that's a great point, David. And that's actually some of the work that we're doing as part of Prevent. And one of the things that we did as soon as COVID, as soon as it was clear that COVID was as huge, as massive, and I think, even when we started this messaging campaign on March 27th called More Than Ever Before, even then we had really not yet completely understood how big, how massive this crisis is and the long-term impact. But on the 27th of March, we launched hashtag More Than Ever Before, to your point, a messaging campaign that really is encouraging every American to pay attention to their emotional health and well-being. More than ever before, we need to do that every day. And we need to look out for our loved ones every day, and we need to reach out to those who are struggling in our network. So we launched that. We've got some great ambassadors who are helping. And the reason we did that is because we knew, to your point, that access to care was going to be a huge issue because our mental health delivery system has been disrupted. So inside the VA has done a very good job of switching a lot of their delivery to telehealth. So just as you and I are working together right now, we know, thank goodness, over the last many years, that telehealth is a very effective way to deliver mental health services. So counseling sessions, and there are some other non-VA entities out there who are delivering care, whether it's by text, whether it's telehealth. But we knew that the system was going to be disrupted. Not all mental health professionals who saw clients in communities were telehealth ready. And so the message with More Than Ever Before was, there were many different layers to it. But one is, we really can't solve this need to care for our mental health and the mental health of those we love by waiting to see professionals. There aren't enough of us, you, me, and all of us, nor do we necessarily need every individual who is struggling to see someone like us. So what we're working on is trying to ensure that we move everything back up, we back it up so that we are talking. It's so good to hear that people are the 94% rate of completing the screeners, the activity that you're seeing on YouTube. We're seeing it too. So what we're trying to do is continue to educate people. We're trying to develop and point them toward other tools, whether they're self-help, whether they're peer support. And there'll be more coming through Prevent and other initiatives that we're working with over the next months and years, frankly, because then that means that the people who are really struggling, the people who, like my mother, who suffered from schizophrenia her entire life and didn't get help because she fell through the cracks, we want to make sure that the people like us who are the trained folks can be there to serve those who are most in need. We're not there yet, but this is where we're heading. And the more that people do what you are offering, the screening, the sharing, the talking to each other, the more we will ensure that people get the kind of care and support they need early to prevent that serious deterioration that ultimately, sadly, sometimes leads to a death of despair, whether it's substance abuse, opioid death, or suicide.
I think it's great. To me, and I don't mean to minimize the suffering that the world's going through right now, as we all seem to be sharing this virus. But the silver lining is people are talking about mental health. It's like we've got to capture this opportunity to make sure that we prevent things. that we screen those right folks and then we get the right folks into treatment.
Agree. And I feel the same way, that I feel this tremendous sense of urgency. I'm very concerned about our at-risk populations, veterans, other people who are marginalized already. But then there's this other interesting phenomenon, and we're leveraging it as much as we can, which is now, for the first time maybe, there's a huge chunk of our nation and frankly the world that can relate to anxiety in a way they never could before. And so it's opened up some hearts and minds. One place that we're seeing it that I'm really excited about and grateful is in our corporate partners in the corporate sector. Employees going back to work, the leaders in corporations are recognizing, wow, we have to address this. We have to look at this and respond to the emotional health and well-being in a new and different way. And so I completely agree. And one of the things that we're doing during Mental Health Awareness Month through our More Than Ever Before campaign is that we're asking all Americans to join the challenge and to share, what do you do to take care of your emotional health and well-being? And we've gotten some great responses from people, because what we're trying to demonstrate, it isn't just one thing. And the goal is for people to learn what it is for you, so that learn the signs that you're struggling, know your risk factors, and know what works for you, so that you can then engage in that behavior, that activity, before you end up either behaving in a way that makes you very upset, causing damage to a relationship. So we're seeing, as you said, and I'm so grateful to work with Google on this effort, because I agree with you. This is massive, and we have to pull together and focus on this.
Well, one thing that helps decrease my anxiety is connecting with like-minded folks. So this has been therapeutic for me. I just want to thanks for what you're doing and look forward to continuing this discussion.
Thank you, David.